What? I've never actually been tested for a penicillin allergy.
I think I'm allergic to peanuts.
Mainly grass pollens, things like dog hair, cat hair.
Spicy food and Mexican foods.
I think it's just peanuts, to be honest. And usually a reaction would mainly just be throwing up. Pleasant.
Every so often, normally during the summer, I found I could not see because my eyes were stinging so incredibly powerfully.
It's just the most extreme reaction I've ever had to anything.
My lips felt like they were swelling up a bit and they were tingly, and my tongue felt a bit larger in my mouth.
I just feel this uncontrollable sickness, not the kind that you can just hope will go away.
I think in the beginning it was kind of like, what the hell's going on? And then after a while, it was like, okay, like I can't kind of breathe.
In the last 5 years, we've seen a 600% increase in A&E admissions for severe allergy or anaphylaxis.
Well, my understanding, such as it is
If you have an allergy to something, then it's definitely more severe than an intolerance.
So if you're allergic, potentially it's a bit more life-threatening, whereas
Intolerance, as in my understanding,
I'm not sure, but I think it's a gut reaction.
But it's not immediately life-threatening.
Allergy, immune response, something your body believes is attacking it and it needs to stop it. It is reacting to a threat. Happens instantly. Can be up to a few hours later, and symptoms can affect the entire body. Intolerance is different. Tends to be more delayed, up to 72 hours later. Symptoms are more around the gastrointestinal tract, and importantly, an intolerance is never severe enough that you can die from it.
The most annoying thing is just not knowing exactly what it is, so just having to avoid like a wide variety of foods just in case.
I can't swim now without getting infections in my ears.
It does mean that I have to put a lot of precautions in place to make sure that I'm safe all the time.
There is a difficulty in that I don't know specifically what's the trigger.
Well, if you've got symptoms and you want to understand more about whether you should avoid things or not, allergy testing could absolutely be right for you.
I really want to get a definite answer as to whether I've grown out of it.
I started to sort of understand that it is an avenue you can go down and get tested. But it wasn't until recently I considered it.
So everybody has IgE. When you get your test results, your total level of IgE will be looked at to say, is there an allergic reaction happening right now? A grade 0 means that really there is no potential of you having a reaction to that allergen. Grade 6 means that it is absolutely definite that you will react to that allergen, and actually to a level where you may need to go to hospital.
Thank you.
Okay, there we go.
And the winner is...
Oh. Okay, wow.
It's quite a lot. I didn't expect that.
Really?
Okay, so I'm allergic to
Peanuts, wheat, soybean, hazelnuts, Brazil nuts, almonds,
House dust mite?
animal hair and peanuts.
coconut, apple, banana, pear.
Peanuts, hazelnuts, Brazil nuts, pistachio nuts.
It says I'm not allergic to anything you tested for.
Clandosporium herbarum? Don't know what that is.
It's a fungus.
My results were negative.
You are allergic to house dust mites and Timothy grass. I'd never met Timothy grass.
Timothy grass, we test it because it's the most common allergen in grass.
Really specific. Or at least I know, so I can be like, okay, this is what this situation is. Can't eat anything in this.
So now it's been put into context for me.
It'll be nice to actually have a conversation with, a specialist, a doctor, and see what can be done about them, rather than just trying to make it up on my own and Google things, which is never a good idea.
It's a lot more extensive than actually had imagined.
Now I have the knowledge that there is some reality behind my symptoms.